Welcome to the Healthy You podcast from NorthShore University Health System, where we tackle trending topics in healthcare. In this episode, we'll be examining the opioid epidemic in America, which is responsible for the deaths of tens of thousands every year and has been declared a nationwide public health emergency by the U.S. government.
Opiate withdrawal is a very serious thing. It's not something anybody should do on their own, ever.
Ask for help. There's freedom on the other side of the addiction.
Look, come back in, let me help you. Let's catch this before it spirals out of control and ruins your family life, gets you fired from your job.
I'm Andy Buchanan. In part 2 of our series, we speak to addiction experts at the Doreen E. Chapman Center, a comprehensive treatment facility at NorthShore University Health System for individuals struggling with substance use disorders. In part 1, we heard from Sharon, a 58-year-old suburban Chicago woman who became addicted to opioids following a surgical procedure to address her chronic pain. After being confronted about her addiction by her sister, Sharon decided to seek help at the Chapman Center.
I got back from Spain and knew I had surrendered in my heart and couldn't do this anymore. And so I attended the intensive outpatient program at Chapman and learned so much there and was with fellow patients, and through their stories and listening and through the care of the team there, which is phenomenal, they taught me that there is a way out, that there is hope.
We spoke next to Patricia Astrene, a licensed clinical social worker and certified alcohol and drug counselor who is the clinical program manager at the Chapman Center.
The Doreen E. Chapman Center is a substance use disorder program. We provide assessments, and during our assessments, what we're looking at is the extent of the problem and what our recommendation for treatment may be. We provide a partial hospitalization program. Some people refer to that as a day hospital. We provide intensive outpatient services where our patients are there 3 hours a day, 3 to 5 days a week. We provide ambulatory withdrawal management, so we can help patients taper off of any of the medications they may be on that they'll experience physical withdrawal. We also have continuing care groups. So those groups focus on helping people sustain their recovery once their treatment at the Chapman Center is completed. We are able to do that because Dr. Parise is on site 5 days a week.
My name's Laura Parise. I'm an addiction psychiatrist and medical director at the Doreen E. Chapman Center. What I find rewarding about treating addiction is that there's hope. And we see it in the eyes of our patients every day. And for some reason, the people that work at the Chapman Center have that vision. And we all have that vision together daily. It doesn't waver. That does not waver. That is universal across our entire staff. Whether we're a social worker, a physician, a nurse, what have you, we all have the same vision for our patients, and that's health and recovery.
While traditionally addiction was blamed on a lack of willpower by the user, we now look at it differently.
Addiction is a brain disease. We at the Chapman Center have talked about addiction being a disease for years and years. Actually, in 1953, it was, by the American Medical Association, identified as a disease. No different than any other disease that needs to be evaluated, assessed, and treated, and managed, most importantly. So we regard addiction as a manageable process of recovery, just like someone that has the disease of diabetes. If someone has diabetes and they eat and they drink things they're not supposed to, their disease becomes out of control and unmanageable. Similarly, with addiction, if people repeat behaviors that are not conducive to recovery, it's going to be very difficult to stay in remission from the disease. But in drug and alcohol addiction comes addictive behaviors, if you will, that we address and treat ongoing. People don't even often realize that they are using these behaviors or doing these things. Part of addiction is it's a behavioral disorder. It's a brain disorder, but it's also a behavioral disorder. And I think because of the compulsive nature of addiction, people are driven in some way to repeat the same behavior over and over again despite the negative consequence. What we try to do when we treat addiction is to kind of break that cycle of doing something different, if you will, intervening on those behaviors that are maladaptive. So identifying that these maladaptive behaviors are not working for someone in their life despite the fact that they're used to this behavior. Ironically, their families become used to this behavior, and everyone responds accordingly in the family when an addictive behavior is, part of the family system. So that's why Patty was pointing out, we treat the family also. We can't just treat our patients. We need to treat the family as well, because these behaviors and this disorder grows and grows and grows in a family system.
Again, Patricia Astrene.
During the time when a patient's in treatment, we do include their family and friends as much as possible. Every Tuesday evening from 6 to 9 p.m., we have a family program where they meet as a group. Then the patients go in one group, the families go in another, and then there's a third group where they meet all together. Also, each patient does have a family session while they're in treatment with us. And whoever they choose to define as their family, they're all welcome.
Chapman Center patient Sharon explains.
The family program at Chapman was essential for my husband and my children to attend and learn more about the disease of addiction and how their mom fell into, being part of the opioid crisis.
Clinical Program Manager Patricia continues.
When a person comes in for an assessment, the Chapman Center, as most treatment centers, use a criteria, and that was developed by the American Society of Addiction Medicine. And we're looking at 6 areas of the patient's life. It's called 6 dimensions. So it's medical, it's emotional, behavioral, and co-occurring disorders. It's their relapse potential. It's their recovery environment. The point is we have to look at everything, the person in all those areas. If you only address the medical and you only detox that person and you don't look at any other aspect of their life, their chances of recovery are very slim. So in terms of recovery, there are more options. Dr. Parise mentioned 12-step, but at the Chapman Center, for example, there are AA meetings available, but there's also refuge recovery, which is a kind of a Buddhist philosophy. And there's also smart recovery meetings. So people have more choices. So many people say, well, I'm not going to do 12-step. Well, there's more options available now for recovery. I think that overall the message is that there isn't just one path to recovery. Chapman Center is an option, but there are many paths to recovery and many choices out there. So don't be discouraged. I think no matter who you are, that you're going to be able to find some program, some meeting that will be helpful to you.
Dr. Laura Parise talks about addiction medicine and how it has evolved over the decades.
I think it was about 18 or 19 years ago, I went to Washington, D.C. and attended a conference that trained me in a medication called Suboxone, which the public really wasn't ready for it. So fast forward about 15 years, and the public is ready for Suboxone now, especially with the perceived rise in opiate overuse. So Suboxone is a medication that is prescribed by physicians that have a special prescribing privilege to kind of coat the opiate receptors of a person's brain that is addicted to opiates to prevent them from wanting and craving so much the opiate. It maintains a steady state of a medication in their bloodstream that is partial opiate and partial opiate blocker, so a person doesn't want to, crave the substance. It's used as a recovery tool so much more than it even was 4 or 5 years ago. So there are people that rather than abusing prescription opiates or heroin and injecting opiates, are taking a medication that's allowing them to not do that, because their brain, they're kind of tricking their brain in a way into thinking that they have opiates on board, which in fact there is a bit of an opiate in the Suboxone, but it's a much safer situation than injecting heroin, if you will, or overusing and potentially overdosing on opiates.
Patricia and Dr. Parise talk about what they have seen in their decades of work in addiction medicine and treatment, and the alarming trends of late, including the unregulated online drug market that many people are tapping into.
What the young adults tell us, and some of the older adults as well we've treated, is they become addicted to a prescription drug when that's cut off, or buying the prescription drugs on the street are so expensive that buying heroin is so much cheaper that they then move to heroin. So the kind of the gateway to the heroin use has been, in many cases, prescription drug misuse. The other thing we've seen much more, probably in the past 5 years as well, I would say, is the research chemicals. It's chemicals that you can buy off the internet, and also people purchasing a lot of different kind of drugs off the internet. And it changes so often that the regulations can't keep up with new things popping up on the internet. Sometimes we're not sure exactly what they're using. The patient isn't exactly sure what they're using either. They can go on a site and kind of pick what they want, and since there's no regulation, they're not exactly sure what they're ingesting.
Research chemicals are drugs that drug companies make in order to continue to learn and research to make new drugs. But some of those research chemicals have mood-altering properties. These are available online on the internet. I call the cell phone a tsunami when it comes to our kids, because in the palm of their hands is access to China, if you will. They can order online chemicals from all over the world that arrive in the mail, and the FDA cannot keep track, cannot follow through on the regulation fast enough for, to squelch these behaviors, if you will. So kids, young adults, anybody, has access to online a plethora of mood-altering substances, whether they're stimulants, hallucinogens, benzodiazepines, or tranquilizers. A big problem is we don't know what's arriving in the mail, being sold on the internet, getting in the hands of our children. And that's a very daunting proposition.
So it can be as simple as starting with a young adult getting their wisdom teeth pulled and being prescribed an opiate and liking how that felt. Because the factors Dr. Parise had mentioned, some heritability factors, some factors going on in the home, they continue to use, leading to more and more and more. They can't get that prescription anymore, they're buying it on the street, and then leading to heroin. And we've heard that story many, many times. That's why at Chapman we have to teach patients all sorts of ways to both deal with their pain, both emotional and physical, by introducing things like meditation, yoga, acupuncture, massage, kind of a much more holistic, kind of going back to basics. Of course, there is a place for opiates in medicine, but I think we're much more aware than probably ever before. We have to decrease that as a first line.
Hospitals around the country have indeed started taking steps to reduce the use of opioids and seek alternative methods of pain relief. Here at NorthShore, a new protocol is being piloted called the Enhanced Recovery After Surgery, or ERAS, which includes a careful plan for the most effective administration of non-opioid regional anesthesia and non-opioid pain medications. Through the protocol, opioid use related to colorectal surgery has dropped from 100% of cases to just 40%. In addition, NorthShore and other institutions are making exciting gains in the growing field of pharmacogenomics. how genes influence a person's reaction to medication. Some NorthShore patients have used pharmacogenomics to find alternatives to opiates. Sharon, unfortunately, had fallen into addiction long before such protocols and processes were in place. She describes the first weeks of her recovery as a horrible time as she struggled with physical symptoms, including body aches, nausea, hot flashes, and headaches, all the while fighting off cravings. It's now been about a year and she's feeling better, healthier, and more centered, and still taps into the resources at the Chapman Center, including aftercare group sessions she regularly attends. She's also pursuing a holistic approach to her recovery and to address her pain issues.
3 years ago, I finally found a homeopathic neurologist and dove in with her and a better understanding of what I could do to care for my neuralgia and care for my body. And it includes lots of vitamins, magnesium, which helps with nerve pain. I take nightly medicine, which is Triphala. It's another homeopathic thing that has what's coming up in the market right now through doctors is turmeric and lots of other things, and introduced me to yoga, which I love and now is part of my life. Meditation, another thing that's deeply in part of my life. Just walking, how actually Rachel taught me this at Chapman, that even the motion of your arms and feet, even 15 minutes a day, can actually start healing in your brain. And physiologically, that can start new pathways. And a daily devotion to my own practice of prayer and essentially having people in recovery around me. I have the team of Dr. Parise at Chapman. I could call on anybody there at any time. I have my friends in recovery now. Other people have been down the road of opiate addiction that I can count on. And now my family is very much a part of my recovery. They have their mom back.
When they come to Chapman, every discipline is doing an assessment, and we come together as a team. What do we need to do first? It's not simply quitting using. Recovery is looking at the whole person and addressing all those wounds and helping the patient learn how to heal.
Addiction knows no socioeconomic barriers. There are no boundaries to this disease. It affects any socioeconomic status. What I have noticed in the last 10 years as a psychiatrist, in a very subtle way, I have to say, but that the stigma and the denial and the shame and the guilt that go along with both mental illness and addiction, I think we've let the air out of the tire a little bit. I think we're more willing as a society to intervene. And I think what's really special about the Chapman Center, to be honest with you, is there is no judgment. We all came to this place for a reason, and I think the way that we respond to our patient population and the way that we're coming to them and allowing them to open up and be themselves and not be judged, I think is highly unique, especially in a medical system where there's a lot of pressure to get the job done and move on. Sometimes we can't do that. Sometimes we need to sit and cry with a patient or listen to a patient or bring their family in.
And our message is call, ask for help. Even if you don't come into treatment, you're getting the information of maybe some resources that may benefit you. So there is still a lot of folks out there that do need help that are not receiving it.
There's no guarantee to any of this, and we know that. We're realistic about it. But when we really believe in this, we believe in treatment, and we believe in the process of recovery, and we believe in the disease of addiction, it allows us to do miracles sometimes with our patients.
And I think at the core of what our belief in treatment is with all our staff is empathy and compassion. We get to see people at their most vulnerable, and we really feel it's an honor to be part of that process. With addiction recovery, the change you can see in even 6 weeks is really miraculous. We learn so much from our patients every day that truly we do feel it is an honor to do this work. I actually started as a student doing an internship at the Chapman Center and just fell in love. Find it, just working in this area is a privilege every day. And I think my message would be to ask for help, because recovery is possible. There's freedom on the other side of the addiction. You know, whether it be the Chapman Center or any licensed therapist, that the first step, it might be going to a self-help meeting is the first step. I spend a lot of time on the phone because we get a lot of calls each day, the Chapman Center, just helping people with that first step, whether they ever come to the Chapman Center or not. We are available to take calls, to put people in the right direction or in some direction towards getting help. But I think the main message is recovery is possible.
I really think that being fearful of approaching treatment, that doesn't need to be anymore. We're an open door. And because we have the multidisciplinary team that addresses all these different biological, psychological, and social factors, we can really tap into, if you will, providing really a different type of treatment than we could even do 10 years ago. There's been so much advancement in understanding how the brain works and understanding how the medications work and, you know, understanding the genetic basis to addiction and understanding really how profoundly this does run in families. There are so many advancements in pharmacotherapy for treatment of addictive disorders. If you don't, however, engage the patient, and if they don't trust you, and if you don't validate them, and if we don't, you know, again, come with open arms, we're not going to make it to that point where we can avail to them all of our tools that we have. So this whole thing is a comprehensive process. It's not just giving someone a medication, having them try it, and go home and see if it works and come back in a week or two. It's so much more than that. And in some essence, it's a bigger commitment on the patient's part, but commitment is the word we love, because if someone's going to be committed to trust us and go on this journey with us, we can truly, really help them, whether it's biological, psychological, social, all of the above.
So Patricia, if somebody wants to reach out for help or just more information, where could they go?
Well, the NorthShore University Health System website, northshore.org. Under services, there is a section that says alcohol and substance abuse services that links to the Chapman Center with my contact number, 847-570-4633, and the main Chapman Center number, which is 847-570-3100. There's a vast amount of education and resources.
The beautiful piece of this whole story is that we really do have the recovery tools for them. We welcome them with open arms. Our hands aren't reaching out, they just need to reach out too and trust.
Thank you for listening to part 2 of our series examining the opioid epidemic in America. Tune into the next episode as we hear from Dr. Michael Nelson, an emergency department physician at NorthShore who specializes in addiction medicine. Dr. Nelson talks about the dramatic moments when an overdose victim arrives in the emergency room and how afterward he works to get addicts more long-term help. I'm Andy Buchanan. This is the Healthy You podcast from NorthShore University Health System.